This is one that you will find very commonly. And actually your patients will really appreciate you knowing strain counterstrain for this. The traditional treatment for piriformis before was to stick the elbow in there and just push as hard as you can. The patient didn't appreciate this very much. Strain counterstrain is much better tolerated. You find that point by first locating the PSIS. We'll start on this left side first. PSIS here, and then their lateral trochanter. I'm going to draw a line directly inferior from the PSIS, and then a line medially from that trochanter, and that's your piriformis tender point. I then will take that point and just push straight in. He has immediate thickness, fullness, and he is very tender there. We'll do the same thing on the other side, finding that PSIS, coming straight down, finding lateral trochanter, coming across until those 2 points meet, pushing straight down. He's even more tender on that right side. In order to do this treatment for this, because he's more tender here, we're going to turn him around on the table. The patient will be prone. Being on a rolling stool is very helpful for this one. The involved side now, that whole leg is going to come off the edge of the table. I'm going to rest his lower leg on my thigh. Once I get the leg off the table, I need to immediately locate the tender point again. There's the trochanter, there's the PSIS, coming straight down and across. There's the tender point. You can see how tender that is for him. Okay. Now, I slowly begin to move this hip into flexion. I'm monitoring the point the whole time. As soon as I feel significant relaxation, I know that's where I want to start. If the leg is not quite at 90 degrees of flexion, and he likes this position right here, then you go to the next part. We're going to then abduct and externally rotate that thigh. Almost gone, but not quite gone. A little more abduction. There it is. How's that? Okay. Good. He's not quite relaxed yet. Take a nice deep breath for me. He hasn't quite let go of that. There we go. Now, how's that? Now it's gone. Okay. So always be careful as you're palpating, making sure that person is completely relaxed. They may need to take a breath to get that to happen. I'm going to completely support this leg. Notice how his leg is on my leg, and I've even got an arm under here so that he does not have to do any active holding of that leg in this position. Again, your hand is here just monitoring, but not having any pressure. You'll maintain that position for 90 seconds. Another key that I've noticed is sometimes when I take this leg off the table, there starts to be too much adductor stretch. If that's the case, you can just gently bring this other leg over to make it more comfortable for the patient. Once the 90 seconds is done, cradle that leg really well as you passively bring it back up onto the table. Once you're done with treatment, you always repalpate your tender point. You do that again, PSIS, trochanter, intersecting line, and significantly better. Good. Now, for treating this patient right now, we found that it was best to keep him short of 90 degrees, but not everybody's going to be that way. If once I bring the person off the table and I'm palpating that tender point, and I find that it doesn't relax until I pass 90 degrees, then you do something different to the leg. Then you actually internally rotate the leg. The other thing that's important too is notice that I'm supporting his leg on my leg by the ankle and lower leg. I don't have anything underneath his knee. It's important that you let that completely relax and let gravity pull down. It will help relax the tissues up here more. So if they're above 90 degrees, you go into internal rotation. Then you would maintain that, monitoring that for 90 seconds, checking that tender point without pressure. Once 90 seconds is done, you would passively bring that leg back to neutral position and then repalpate.